My name is Joseph Asunka, CEO of Afrobarometer. Afrobarometer is a Pan-African survey research project.
I'm Mariba. I'm director for the Ouagadougou Partnership Coordination Unit.
Joe, Afrobarometer has been tracking governance and democracy across Africa for more than 2 decades, but this is the first time that you've included a dedicated module on sexual and reproductive health. The survey reached nearly 51,000 respondents across 38 countries between 2024 and 2025. Can you walk us through the headline findings? Was there anything in the data that surprised you?
The key highlights from this study is that support for women's autonomy in decision making about when to get married. There's a lot of support for that. So we have majority support for the women's autonomy to decide on when they will get married. We also have a good level of support for when the women will decide whether or not to have children and how many children to have. I think the distinction is that support for women's autonomy in childbearing decisions is much lower than when it comes to women's autonomy in marriage decisions. So that's one big difference. The strongest indicator for support in this data, the findings, is girls' education. There's a strong support for girls who get pregnant to go back and continue their education. And this is across all countries of surveyed, is majority view on the continent.
Marie, the Ouagadougou Partnership has been working in Francophone West Africa for 15 years, precisely because this region has lagged behind the rest of the continent in terms of family planning access and outcomes. Now you have survey data from 7 of the 9 OP countries showing, for example, that support for women's autonomy in reproductive decisions sits at 42% on average, compared to 62% across the continent as a whole. Was anything in these results particularly surprising to you? Or did the data largely confirm what you've been seeing on the ground?
So we weren't as surprised. I think there are some of the results that we're expected, especially in terms of where the countries lied in terms of women's autonomy. And I think that was good news for us when we saw the support, the amount of support for women's autonomy, and also the support for girls to be able to get back to school after a pregnancy, because school pregnancies are a huge issue in some of these countries. Obviously, I think what the data shows and what some of the results show is that we still need to focus on some of these values and social norms and demand creation, right, for family planning, because there is this dichotomy between the aspirations, and that's coming from men and women, right? The aspirations that they have for women to be able to decide, but then when it comes to how they decide, that's where access to contraception is a bit more, at least in their views, should be more limited. And again, that part we're not as surprised as well, because a lot of them will think that that should happen through abstinence, which isn't as realistic, obviously. Young people and youth are being sexually active. They need the information, they need the education. And they also need the access to contraceptives if we want to prevent early pregnancies and girls getting out of school and not being able to finish their education.
One of the things that stands out in the data is how much attitudes vary by demographic group, different education levels, whether they're living in cities or in rural communities, and how old they are. Joe, what does the data show about how younger Africans view these issues compared to older generations?
What we find is more educated people tend to have more progressive views on sexual reproductive health and rights. And when you look at the Afrobarometer data set, younger people are much more educated than the older cohorts. And we think some of the drivers of progressive attitudes towards sexual reproductive health and rights is driven largely by education. And so because the younger people are much more educated, they tend to have more progressive values and our views towards SRHR issues. And so on our data set, whichever country you take, you will always have majority of younger people being more progressive, maybe more supportive of, say, universal access or unrestricted access to contraception. And I think in some ways, for young people to have these progressive views is a positive signal for us when it comes to working in these issues, because Of course, we know that the median age in Africa is 19, and so it's a very young population. And having them have these progressive views about what it means to have the tools that allow young people to plan their lives is critical. And we are glad to see that that is the case in the data.
Right. Yeah. And that's great news for the future of SRHR. And we've seen it in the OP countries where the youth are demanding to be drivers of change. And I was mentioning earlier the example of the amount of activities and program designs that are geared towards youth and providing them for better access to contraceptives, education, as well, comprehensive sexual education. So we're not surprised at all that they're more interested, more progressive about their future, and understanding that all of the decisions that they might make about their lives are going to be also directed and skewed depending on how many children they have and when. And so being able to plan for their families around their work, about their faith, their religion, their values is also extremely important, and that to understand that family planning affords them that it's a right. It's not just a health issue, it's also a right that they have to be able to plan. And so seeing that coming out of the result as evidence and not just anecdotal was also very important for us.
The survey covered 38 countries, 7 of which are Ouagadougou Partnership countries. When you compare those 7 countries to the rest of the continent, you see real gaps. For example, only 44% of respondents in the OP countries support contraceptive access, regardless of marital status, compared to 58% across Africa as a whole. Joe, can you walk us through what the data shows about how the OP countries compare to the broader continental picture and where you see signs of change?
All right, so the survey did cover 38 countries on the continent. 7 of those were from the Ouagadougou Partnership, and then 31 countries for the rest of the continent. If we look at the averages in terms of women's support for contraceptive access, for example, the rest of the continent, the 31 countries, we often have majority support for access to contraceptives. And then, of course, even when it comes to women's autonomy in decision making, there's still that high support in the rest of the continent compared to the Ouagadougou Partnership countries. And I think, of course, that is the start of the Ouagadougou Partnership was actually orchestrated by this gap, that the rest of Africa seems to be more progressive in these issues than the Ouagadougou Partnership countries. And I'm glad that at least it looks like in some of the countries in the Ouagadougou Partnership, the gap seems to be closing. Whether you're talking of Cote d'Ivoire or talking of Benin, or there seem to be, at least when you look at the gap between Cote d'Ivoire and the rest of the continent in terms of the averages, they are much closer. And the hope is that the rest of the Ouagadougou Partnership countries will come up as interventions by Marie and her team progresses.
Marie, I'd love your perspective on that continental gap. The Ouagadougou Partnership was explicitly founded in response to the fact that Francophone West Africa was falling behind the rest of the continent on family planning, and this data suggests that that gap still persists. From your vantage point, what's driving it, and what does the survey tell you about where there are opportunities to close it?
Right. So the difference is, as Joe was saying, the premises of the Ouagadougou Partnership was that difference that was being seen. For many reasons, language was one of the reasons, less interest from foreign institutions and organizations because it's not a region that they really understood. A set of social norms and values that these countries share. And I'll talk about some of the differences they also have. And that is the reason why the Ouagadougou Partnership was put in place. And also one other mention is that the amount of funding and investments that were going to Francophone West African countries was less. For every dollar invested in the rest of Africa, about 70 cents were invested in Francophone West Africa. So that accounts for some of this gap that we were seeing. But I think the great story about the coming out of the results that we saw is that gap is closing. And for me, coming from the region and seeing some of these results, I was pleasantly surprised about the amount of support that I was not expecting to see. And so that just goes to show that the efforts are paying off, that there's impact in some of these policies that we've been putting in place. And I think the greatest story here also is that there needs to be more support for demand generation, demand creation, tackling those these social norms and values that are hindering the progress and uptake for family planning and contraception.
The survey establishes a baseline. This is the first time that we had this kind of granular continent-wide data on public attitudes towards reproductive health. Marie, given the Ouagadougou Partnership goals over the next 5 years, what do you hope future rounds of this data might show? And what needs to happen in terms of policy and programming and investments and political will to help move those numbers?
I think the first step is to help Afrobarometer, linking them with experts from the field, from the region, from the ministries of health. What do they want to know? Is there a particular policy that they think if the constituencies thought a certain way, that would help have more progressive laws and regulations around and policies around SRHR, and being able to include that in the questioning and the surveys. So I think that would be the first step of putting them together with SRHR experts in the country who actually know the context. And I particularly appreciate the way it's dissected, that it's very clear and easy for people like us who are not researchers, who are not used to data, being able to read and also disseminate, and having the lecture that is needed to provide to decision makers. So, for example, within the Ouagadougou Partnership, we have certain instances where we have a rapport and exchanges with authorities and decision makers, and where it's actually one of our objectives, not just to remain within the ministries of health, but go prime minister, president, and for them to be comfortable enough to talk about SRHR, and have the language and have the evidence, not just the language, but also the evidence to support some of these policies. When I first joined the OP, a lot of, even within ministries of health, didn't want to talk about family planning. It was taboo. They were still talking about birth spacing. And so seeing how that environment has shifted, how the language has shifted, was anecdotal, but now we have the evidence to see that, it's actually moving and shifting. So these are the things that we're hoping that the narrative of this evidence is going to be able to bring about and have the decision makers. And hopefully if we have even a couple of policies that are changed, I think that will be a measure of success for us.
Joe, Afrobarometer's core mission has always been about democratic accountability, giving citizens a voice and giving policymakers the data they need to respond to what their constituents want. As you think about the future of this work, what does success look like? And how does Afrobarometer fit into the larger ecosystem of actors who are working together to translate this data into change?
There's one thing: the policy can be adopted. When it comes to implementation, there may be gaps. Who holds government accountable to make sure that those gaps are filled? I think our overall objective is that sustaining that democratic foundation that allows citizens to be the ones who really can move the needle. If they have demands on their governments, they can make it, and they can make it through the platform, the Autonomy, but also they can provide a level of support to civil society groups like the Ouagadougou Partnership that work on certain issues, that when there's momentum from the citizens backing a particular issue, then of course that backing also creates an incentive for politicians to respond, because they know that their power depends on whether or not they respond to what the citizens are actually demanding. And I think creating an environment where that kind of accountability relationship can thrive is where we want to go. But I do think, what Marie said was, going into the next iteration of this particular survey on sexual reproductive health and rights, just thinking about what questions we should be asking. And I think engaging with ministers of health makes a lot of sense, because they would use the data. And we create the data because we want it used. It's not just creating the data. And so if we can tailor it to questions that people prefer, even if there are questions that we prefer and they don't, we don't need to ask them. It's not what we want, but what the users would actually like. And so just contextualizing the questions so that we can ask relevant questions for ministers of health and other activists who may want to use the data for their work.
Thank you, Joe. Thank you, Marie.